We can do it, homie. Been there.
Hi, how are you doing today?
I'm good. How are you?
My name is Mary Rose Gullet. I'm a licensed clinical social worker. I've been in the field now for about 3 years, and I'm excited to get to know more about you. And your name is Megan, correct?
It's Megan.
Yes, is it all right to call you Megan?
Absolutely.
All right. Well, before we get started, I just wanted to let you know that anything that we say here is confidential. It stays between you and I. However, I am a mandated reporter, so if you do talk about harming your children or harming yourself or anyone else, I am required to report that. But anything outside of that stays totally between you and I. Is that okay?
That's okay.
All right. Well, why don't we get started? Why don't you tell me a little bit more about what brought you in here today?
Well, I've been having a hard time just basically wrapping my head around certain things, aspects in my life, and just wanting to get it out, clear, open, and see another point of view kind of thing.
Okay.
Thoughts out there.
All right. Do you want to talk a little bit more? Is it more what's going on, within your family? Is it?
It's more like my past that's kind of eating me. I was being brought up in my present time. I started recently going to church. And today during church service, they started talking about abortion and how, of course, absolutely, I don't agree with it. I'm pro-life now, and before I was pro-choice. And being pro-choice at the time, I did have an abortion, and that to this date, now having 2 children of my own and a stepdaughter, it's like wrapping my head around it, like I could have had another baby, a third baby. And my life could be totally different the way it turned out to be. And that baby could have saved me then, instead of sitting me down the downward spiral that I went down. And boy, oh boy, I went down a downward spiral. So it's bringing up all those feelings for me, and it's hard for me to process. And that's why I'm here today, to help do that.
All right. Well, I can understand that, things in our past can be incredibly difficult and hard to process. I'm really sorry that you're going through all of this and that you've gone through this previously. And I can understand that this would be very, very difficult for you, and understand why you're having a difficult time processing what's been going on right now.
Absolutely.
So do you want to, it's wonderful that you've got, your church to support you at this moment. Having a religious aspect to what you're going through is important. Mm-hmm. Another thing that is important to focus on is it sounds like you have some young kids right now.
Oh, I do.
You do?
I do. I have a 3-year-old, 7-year-old, and my 11-year-old. Oh, man. Those time gaps, those age gaps, they're ruined, world. Let me tell you.
I can totally understand. And are you still married?
I am married.
Okay.
I'm married.
Do you want to talk a little bit more about your relationship with your husband?
6 years married. We're good. Life throws you curveballs, let me tell you.
Okay.
As long as we're very open and honest with each other, and I think that's really what's saving us, especially now, in today's time.
So your relationship with your husband is good. Even though you're still just kind of struggling with some issues from your past, your abortion from when you were younger. Were you in high school around that time?
I just got out of high school.
Okay, so you were really young during that time.
I was homeless too.
Well, it sounds to me like you might have made those choices with the knowledge and the information that you had at the time. And what's important to think about that is you handled it at that time in the moment, and you right now it's okay to be able to be working through some of those feelings and to have some of that come back, especially when you have young kids.
Especially once you can provide a roof over those kids' heads, and maybe I could have done it. Maybe I could have done it, but yet you never know, because at that time, that's what I felt was best, so it's, but it still eats you.
That is understandable, and it's understandable that you would feel that way. But I want you to stay more focused on the positives. I think that you've got a lot of strengths. It sounds like you're a great mom right now with your children that you have today that are with you in your home with your husband. So I think it's important to focus more on that. And you do believe in a higher power.
Absolutely.
And within, the church, they do talk about forgiveness. So I think it's important maybe for us to look into what the church has to say, maybe even your local church, looking into some ways to really forgive yourself, to move past those types of emotions. Because just like you said, you made the decision at the time with the knowledge that you had. And I know that you talked a little bit about your kids right now. Have you had any previous medical diagnoses either, as far as like a PTSD or
Bipolar disorder, PTSD, anxiety.
Okay. And I know that you had mentioned that on your chart. So I kind of wanted to talk a little bit about that. Are you currently medicated at the moment?
I am not, no. I have been previously medicated. At the moment, I am not.
And what kind of medicines have you been prescribed previously?
I have taken quite a different many. Zoloft, Prozac, Xanax, Valium, lithium, started with an S. I can't remember the name of it.
That's okay. That's all right.
Well, we run out of this.
Are you open to maybe if you talking with a psychiatrist at all, to maybe thinking about getting stable on some of those meds? Because sometimes
yes and no. I am a firm believer of medical marijuana, so that has definitely helped me. Higher CBD and low THC for my anxiety has made a tremendous impact with that. Of course, you have your high days, your low days. I try to be stable, but, sometimes you can't be stable. And that's when that CBD, THC has been helping me with that. I have considered going back on medication during recent events. It is a possibility. It's not like it's totally off table. I feel if I can't control myself, then yeah, probably.
And you feel like you've been having some of those uncontrollable feelings lately?
A few days here and there, but other days it's like, what? You have to wake up, be strong, because I have other children out there that I have to take care of.
Absolutely.
Absolutely. And of course, I'm working on putting me first, making sure I have my mental time in the morning before I even wake up and be mom. Because if I wake up and be mom before I can be me, it's a long day.
So you've got some steps to definitely, try to, maintain your anxiety lower and your stress lower. Would you be open to maybe there's some different types of stress techniques? There's like a neural therapy. It's like a sound wave therapy. Do you like music?
I do like music.
Okay. So it would be in the evenings before you would go to sleep. Before our next session. So I'd like to see you again in about 3 weeks. So in between now and 3 weeks, you would listen to this video. It's about 30 minutes, recording about 30 minutes long as you're going to sleep. So if you fall asleep during it, you're still listening to it. Would that be something that you'd be open to doing?
Yeah, absolutely.
Okay. All right. I think it'd really help your everyday stress with just being a mom and dealing with some of your emotions from the past and your current emotions right now. Trying to maintain. Being a mom sometimes can just be stressful in itself.
Right? You got a little freshman middle schooler, and then you got your second grader, and then you got toddler. So yeah,
We're so full, but you lighten up when you talk about your kids and your husband. It sounds like you have a really good support system at home.
I do. I remind myself that sometimes.
Yeah, absolutely. And you're also involved with a church, which gives you a really good outside community. I wanted to real quick just ask you another quick question as far as maybe some goals that we have over the future.
Okay.
I'd really like to, over the next 3 weeks, have you talk with our office psychiatrist and maybe talk about medicine. This would be between you and her. You can discuss with her which medicines you like, which ones you don't like. Maybe try and gain a little bit of stability between here and our next session and see where you're at. We can do the stress technique music. I'll email you that after our session and everything. And I really think that it would have some really positive positive improvements hopefully over the next 3 weeks.
Okay.
I did really want to, real quick, before we go, I wanted to talk a little bit more about your kids and your home life. And I didn't hear you mention, if you have any friends or anything. Do you do anything hobby-wise? Do you have any friends?
Hobby-wise? What's hobbies when you have 3 children?
Hobbies?
I love gardening. I do love to garden. So that's one of my things. I love growing my own food. My main goal is eventually we'll be having property and become as much, self-sustainable as we could. So,
absolutely.
I want a big garden. I want lots of chickens and, ducks running around, that sort of thing. So, hobbies right now is definitely my garden. I have, some craft hobbies, but I pick up one thing and I think it's so awesome. I get involved in it and I'm like, I don't like this anymore. I don't want to do it anymore. So I go to the next one. And, I accumulate little craft hobbies.
But you found that gardening has been something long term.
Gardening I stick to. I like that one. I produce something. I have a harvest. And it shows, I have produced something. I've done something.
And you're able to give that to your family. You're able to feed your family that, and you know what's going into it. I mean, that's very, very awesome. Absolutely. Do you have any pets or anything like that at home?
I have a dog and a cat.
Okay.
Milo and Salem.
All right.
Is my rambunctious little, what is he? I can't remember. Golden Retriever. That's what he is. He's golden. And then Salem, our black cat. So original, I know. But Hocus Pocus. So.
Oh, that's very, very cool. And it's right around Halloween right now. So was he born around Halloween?
He was born on a Friday the 13th in September. I know. It was like, all right, he's destined to be a Salem.
Before we go today, I did want to go back to talking about your history as far as we had talked about the manic depressive diagnosis. Mm-hmm. How old were you when your diagnosis was?
So I've been in therapy since I was 5. And on and off between different therapists. My parents moved me to different therapists, and each one would recommend a new kind of medication for me. My parents were not on that page. They were just like, oh, no, we're going to another one. No medication, no medication. So I didn't fully get a diagnosis until I went and seen a doctor myself without parents. And they were like, yes, you do have these, you're bipolar, you have, severe anxiety, nervousness disorder, like they started. They ran a few mental.
You mentioned that it started around 5. Was there anything else that went on in your childhood around 5? That age?
5 years old. Well, my mom left. So, mom kind of leaving just with dad, that sort of thing. And
that could be very traumatic.
Yeah, very, very traumatic. And there was, a couple other things, sexual abuse-wise, and just, a little rough childhood.
Okay. So do you think, I'm very sorry that you went through that at a young age of 5, and it sounds like you had some sexual abuse issues as you got a little older. And that's a very difficult thing to go through.
Yeah.
And post-traumatic stress disorder is very similar to the bipolar disorder. And I would still like you to go talk with a psychiatrist. But in addition to having the bipolar, you may have some post-traumatic stress disorder. Something as traumatic as your parents separating at a young age could really cause some of those issues if you add in sexual abuse. Mm-hmm. And then, your later abortion that you're having some anxiety and some stress from. All of those could really tie into a lot of the issues that you're having now.
Yeah.
Yeah, for sure. Well, I hate to cut it short, but I would definitely like to talk more about your childhood, the PTSD, and everything in our next session.
Okay.
And we'll get your psychiatrist set up before you leave today, and I'll get that emailed out to you. But in the meantime, I really want you to focus on the positives in your life. Focus on your children, your wonderful children that you have at home, your wonderful husband, your church and your gardening in between now and then. And I really look forward to seeing you next time.
Awesome.
All right. Do you have any questions before we
I
go?
don't.
All right.
We covered it.
All right. Well, thank you so much.